as soon as we get all the vaccines, we'll be able to achieve. And of course, as the vaccines became more available, complacency also when the infections go down from the height of almost achieving 300,000 vaccinations per day, we are now down to just over 150, 160, 170 vaccinations per day when we have a full capacity to can be able to roll this out. But in a way, we are pleased that more South Africans have been coming forward to the extent that as we are here today, we can say that just over 226, just under 26.5 million doses have been administered, and with just over 17 million individuals having had at least one jab of either of the two vaccines we've been using, with the adult population just a little under 43% currently covered. So we're still hopeful that we can reach our 70% of adults by the end of December, because we indeed do have the capacity. So we want to again just call on, encourage our people to come forward, because this is the intervention which we believe that can indeed save our lives. Of course, with the advent of the new variant, has brought in more urgency, more pressure on an already, very pressurized society. We see the pattern also being highly transmissible, affecting also younger population, under 40s, and even children and toddlers, also some of whom are getting admitted. We are at the same time encouraged by the fact that at the same time, at least the preliminary indications are that even though the variant is highly transmissible, very few people are really getting very, very sick to require serious hospitalization. Even the reports which we have been receiving has been that even amongst those who are admitted, majority are in the general wards. Majority of those don't even need oxygen. So it is encouraging, even though we know it is still early. But ultimately, we want to say to our people that we can survive all these pandemics and epidemics if we work together as a population. And we are very pleased that the ICASA conference is taking place, and we're looking forward to innovative discussions and representations of research, which hopefully will be able to take us forward. So we're hoping that indeed we can work together so that the pandemic does not undermine our work in terms of prevention and treatment of TB, AIDS, STIs, that all these responses must not be reversed. So we want to commit that at least by 2022, more districts than the 4 in KZN and a few others in the country will have achieved 90-90-90, and we will be ready for 95-95 by the year 2025. So we look forward indeed for this very enriching discussions during the course of this week. So thank you to the leadership of ICASA. Ladies and gentlemen, it is my pleasure to invite to the podium now our Deputy President, also Acting President. He is our leader in this fight, both, as I've said, in the fight against HIV, TB, and STIs, but also leading us in getting our people. Thank you.
Can I?
Yes, please.
Okay. Thank you very much. We can take our seats. Program Director, thank you very much for the opportunity accorded to us to address this conference. The ICASA 2021 President, Professor John Idoko, the Premier of the province in absentia, represented by MEC for Health, Nomakuku Simelane. Thank you for hosting us. Minister of Health, Dr. Pasha, UNAIDS Executive Director, Ms. Winnie Piayima, our World Health Organization, Regional Office Executive Director, Dr. Mweti, representatives from PEPFAR, conference organizers, all the speakers and delegates who are here, distinguished guests, ladies and gentlemen. As we gather here today, in the midst of the most devastating epidemic in our lifetime, it is my honor to welcome everyone to our country as the host for the 21st ICASA conference. In doing so, we also want to pay homage to the immense contribution of former President Nelson Mandela in putting the fight against HIV and AIDS at the center stage of development in post-apartheid South Africa. The passing of former President Mandela in December 2013 was a defining moment for the people of South Africa and the continent as a whole in recognizing the major strides that have been made in our collective response to ensure that we continue to save lives and prioritize interventions to curb the spread of HIV and AIDS. It is therefore opportune for the 21st ICASA conference under the theme Africa's AIDS Response, the Race to 2030, Evidence, Scale Up, Accelerate, to be hosted at this point in time. As delegates to this conference, we want to use this critical platform to further engage our continental partners and stakeholders to review the post-Sustainable Development Goals framework, considering the impact of both the HIV epidemic and COVID-19. Sustainability of the response in reaching the new Global AIDS Strategy targets, which is the UNAIDS 95-95-95, will not be possible if human rights are not a key priority in ensuring non-discrimination and ending inequalities. This remains the fundamental principle of leadership and care in the context of strengthening the application of science-based evidence. 6 years ago, in 2016, the international community set an ambitious target to end AIDS as a public health threat by 2030. This led to the UNAIDS 1990 targets that were adopted by many countries in the region. Regrettably, by 2020, most countries had still not met this target, though many had reached the first 90 of all our people living with HIV, knowing their status. Therefore, welcome the collective efforts of UNAIDS and its partners, as well as that of global leaders at the UN General Assembly in September this year to adopt a political declaration pledging urgent transformative action to stop the global AIDS epidemic by 2030. The SADC community and health ministers, also acting in line with the 2016 United Nations political declaration to end AIDS in 2030, recommitted themselves to this goal. In addition, they decided to strengthen their HIV prevention programs to reduce incidence of HIV by 75% in 2020 from the 2010 baseline. The new global target is now 82.5% by 2025. In this regard, the framework for target setting for HIV prevention and the regional scorecard for HIV prevention further provides guidance in measuring progress to reach our targets and is, in effect, our blueprint and a point of reference to guide the rate of our collective response. While international solidarity and community resilience has saved millions of lives to date, a lot more still needs to be done. Many of the inequalities that facilitated the spread of AIDS pandemic are getting worse and continue to drive HIV in many parts of the world, most often affecting the most vulnerable within our societies. However, there is hope, and the solutions lie within the 40 years of experience in the HIV response that has provided us with evidence of what works. Some of this can be drawn from the working models, especially in this province of Operation Sugumasake, which is a very successful model, and I'm sure we are going to share this model with the delegates in this conference. As Africa, it is clear that the impact of colliding HIV and AIDS and COVID-19 pandemics have foregrounded the necessity to invest in health infrastructure, to improve access to quality health care, and address inequities and structural exclusion in the provision of health care services for all our people. Our response to HIV and AIDS, TB, and COVID-19 must be intertwined with our efforts to address underdevelopment, to address poverty and inequalities as determinants of poor health outcomes across the continent. It behoves our governments and leaders to ensure that more health facilities are built in underdeveloped areas to ensure that our poor and all those who feel marginalized can have access to treatment and care. If we are to meet the targets 95, 95, 95, we must ensure that no one is left behind. Investing in the requisite infrastructure, human resources, and effective drug supply systems on the continent will be very critical. Equally, Africa must invest in research and innovation to build resilient capabilities for the development and manufacture of critical vaccines, drugs, and ancillary medical supplies that will support the rollout of our health programs on the continent. As Africans, we have always spoken of unity, of purpose, beyond existing artificial borders in order to achieve development and integration of our economies and our people. This is the time to move beyond rhetorics and forge collaborative platforms for research and innovation to promote intra-Africa cooperation in the development and the provision of health solutions that all the peoples of this continent so much need. The lessons that we've learned of the COVID-19 vaccines rollout program have taught us that as a continent, we need to invest in our own capabilities to overcome the hogging of vaccines by wealthier nations, thereby effectively responding to current and future epidemics and pandemics. Therefore, the conference of this nature offers us a right platform to amplify our individual and our collaborative efforts and responses at national and international level towards achieving our objective of ending AIDS as a public health threat by 2030. Our scientific prowess as Africa is proven. That is why our scientists were able to detect and sequence the genome of the Omicron variant and its mutations with precision, and in the process of contributing to global efforts and initiatives of understanding and defeating the COVID-19 pandemic and its mutations. As African countries, we have always understood that in this world we are interdependent and no one is safe until everyone is safe. Therefore, there is no need to adopt an antagonistic positions towards one another. We are not enemies. HIV and AIDS is our common enemy that we must unite and defeat. Global cooperation and solidarity in times of unprecedented crisis like the pandemic we are faced with necessitate that we work together to find answers to important public health questions that are confronting us at the moment. We are in full support of the comments made by the Executive Director of UNAIDS, Ms. Winnie, who said that despite the disruptions caused by COVID-19 pandemic, we must act and act urgently to prevent the resurgent global AIDS pandemic and quickly recover our progress towards ending AIDS. These comments are also in concurrence with the political declaration that was agreed upon at the United Nations high-level meeting, calling for an urgent, transformative action to end the gender inequalities, restrictive laws, and all forms of discriminations that fuel the global AIDS epidemic. This is particularly important for countries, including South Africa, that have relatively high levels of sexual and gender-based violence and femicide. Continued high levels of stigma against people living with HIV, as well as stigma and discrimination against the LGBTQI+ community. In the case of South Africa, the National Strategic Plan 2017 to 2022 states in objective number 3 that no one should be left behind in the HIV, TB, and STIs interventions. To operationalize this objective, we launched the Human Rights Plan, updated and relaunched the Sex Worker Plan, while still implementing the LGBTQI+ plan. These plans contribute towards guiding our holistic implementations of services to all, as well as sensitization of healthcare workers in all our public health facilities and implementing partners. Globally, there has been remarkable gains across the HIV testing and treatment, cascading towards the 90 targets and in transition to the 95 targets. In 2020, 84% of people living with HIV knew their HIV status, and more than 2/3, which is 73%, were on ARVs, while 66% were virally suppressed. This progress shows that more than triple growth since 2010. Gains in treatment effectiveness, as well as an increase in the number of people who know their status are on treatment now, are reflected in the fact that viral load suppression levels amongst all people living with HIV increased by 18% between the year 2015 and 2019. Almost 66% of people living with HIV globally had suppressed viral loads in 2020. Regrettably, though even with these great strides, the global target for 2020 was not met. The South African government provides millions of male and female condoms to prevent acquisition and/or transmission of HIV and sexually transmitted infections, as well as unplanned pregnancies. We're also implementing innovative strategies for HIV testing for all and comprehensive interventions that contribute towards a reduction of incidence of HIV, STIs, and TB. Recent data from our dashboard shows that South Africa is currently at 93, 72, and 89 of the cascades for the total population serviced through the public sector, broken down amongst the subpopulations, the following variations is noticeable. Adult females are at 95, 76, and 90. Females are doing very well. Adult males at 92, 65, and 90. Children at 80, 66, and 65. To achieve the 90-90-90 targets, South Africa must increase the number of adult men on ARVs treatment by at least 548,531. Adult women who must be introduced on treatment at least by 437,728. Children on antiretroviral treatment at least must be increased by 70,494. Data that is available in the private sector indicates that additional 4,789 children, 90,515 adult females, 112,472 adult males are currently receiving ARVs through the private medical aid schemes. This progress shows that, like our regional counterparts, we still have a long way towards reaching subpopulations, including children. Innovative interventions are needed to ensure that we reach our 90-90-90 targets as we move on to 95-95-95 targets. In the midst of the COVID-19 pandemic, self-care interventions such as HIV self-screening have shown to be critical to ensure that the under-tested and the test-averse populations, including key populations, youth and men in general, are reached with our testing services. Prevention is, however, the mainstay of every intervention, whether in public health, social ills, or any other adverse scenarios. That is why we welcome the pre-conference event involving young people, as their participation is crucial in this fight, as we seek to accelerate their leadership, their resilience, and innovations to end AIDS as a public health threat by 2030. As a conference, we are required to emphasize transdisciplinary approaches in order to transcend the artificial barriers between government and our civil society, the academia, and business, and to collectively identify resource-tailored interventions for all affected populations in our respective countries, more especially those that change and improve the lives of women, children, adolescents, and our key populations. If anything, the lessons from these colliding pandemics, especially COVID-19, are teaching us is the importance of strengthening our health systems to integrate high-impact intervention and comorbidities, emerging infections, and non-communicable diseases. Therefore, the success of this conference will be on how we institutionalize concrete and actionable resolutions that give meaning to the political declaration made at the United Nations level. Alongside COVID-19 challenges, we should not lose momentum in our fight against HIV and AIDS, but we should ensure that all our HIV and AIDS programs are embedded in our overall response to the COVID-19 pandemic. COVID-19 will remain with us for the foreseeable future, and therefore it is critical to integrate our delivery systems and platforms in such a way that the fight against HIV and AIDS continue to be a policy priority to achieve population health, compliance with and practicing what we know, including public health safety measures, will protect us from those colliding viruses. Once more, Program Director, on behalf of the government of South Africa and the people of this country, we wish to welcome you in this conference and wish you a very successful deliberations and outcomes that will be helpful to the entire continent as we fight the scourge of HIV, AIDS, and TB, as well as STIs. I thank you very much. Thank you.
Well, Deputy President David Mabuza, in his capacity as the South African National AIDS Council chairperson, reiterating that inequities and exclusions in the provision of treatment and health care will be addressed. And he was speaking at the 2021 International Conference on AIDS and STIs in Africa, which convenes people working in the field of health, as well as leaders, people living with HIV, and others committed to ending the epidemic, to discuss the African region's HIV epidemic and the unique response to it. Now, leaders, activists, scientists, and community members from around the world will share the latest scientific advances and as well as learn from one another's expertise and develop strategies for advancing all facets of our collective efforts to end AIDS by the year 2030. Well, Deputy President David Mabuza was addressing that ICASA AIDS conference in Durban. Let's now move on to other news. Mpumalanga police are investigating 2 cases of